Hello everybody, Dr. Marcus Butler is my name from the Asthma Society of Ireland, and I want to thank you for all the questions you've sent in. We've been fielding an enormous amount of questions through the Asthma Society advice line, and we're very grateful for all the questions, and hopefully we will be able to continue to give you as much help as possible in this difficult period that we're going through. There are many questions, and I want to touch on some questions that were sent in to us, and thank you for sending those in. I want to start just by going over some important advice, and what I'm going to say is pretty much exactly as you've heard coming out of the HSE. This advice is absolutely spot on and essential for us to give ourselves the best chance of getting through the current challenges. So there are some groups of people who may be at more risk of a serious illness if they catch coronavirus. And I think anybody watching with an asthma background appreciates by now that asthma patients would be included in the group of patients that need to be more careful. The HSE doesn't think that any of the groups of patients that I'm going to talk about are at any higher risk of catching the virus. It's nothing to do with how easy it is to catch the virus. But if you catch the virus, you are at a little more risk perhaps of problems. And that's why it's important to be particularly vigilant in following the advice that you're hearing about all the time from the HSE. So the group that are at risk of serious illness, as mentioned on the HSE website, would be those over the age of 60, and particularly those over the age of 75. It includes those with a long-term medical condition. And they state, for example, heart disease, lung disease, diabetes, cancer, stroke disease, circulatory diseases, kidney disease, liver disease, or high blood pressure. And obviously asthma is one of the key lung diseases, and therefore it is included in this group. Other people who are in this group are those who have a weak immune system, such as the immunosuppressed, or those who have a medical condition that can affect their breathing. Now that of course includes asthma, particularly significant asthma. And it also includes in the group of people at risk those who are residents of nursing home, residential care setting, and those who have specialist disability care over the age of 50 with an underlying health problem. So that's the overall group of people who are currently listed as being at risk of serious illness. And there is some advice that applies to those people. And first of all, the advice for anyone in an at-risk group is at a minimum no different to the advice for everybody at the moment. And if you've been following the recent updates in recent days and weeks, you know that the advice for everyone at the moment is to stay at home as much as possible, to only leave to go to work, to go to shops for essential supplies, to care for others, or to exercise outdoors once a day, and if possible to work from home, to ask others to shop for you, to leave supplies at the door for you, and that you don't actually self-isolate unless you have the symptoms of coronavirus. Everybody who has symptoms of coronavirus, asthma or not asthma, will need to self-isolate. And if you're caring for somebody who's in an at-risk group, you follow the general advice on how to protect yourself from coronavirus. But then there are the extra precautions that apply to people who are in the at-risk groups, and that includes people, of course, with significant asthma, with problematic asthma. So you should, in that situation, be telling people not to visit the house unless it's absolutely necessary. And this includes family who live in another house and who want to visit you. It's very difficult. It goes against all of our social fabric to implement this advice. It's so difficult, but it is important. It's life-saving across the population to implement this advice carefully and rigidly. If you do have to meet people, it's important that it's in a well-ventilated room or outdoors, and it really should be as brief as possible and only necessary. It's important to ask visitors to wash their hands properly. Of course, at this stage we've all got the message about the 20 seconds of hand washing, careful hand washing. It's so important to repeatedly do this several times during the day. A lot of us are not good at implementing the keeping our hands off our face, but you can get around that to a large extent by making sure those hands are clean. So repeatedly cleaning them throughout the day will make up for other lapses that you have. That your first and your last line of defence is washing your hands. That's the most important thing. You should ask visitors to keep a space of at least 2 metres between you and them. Now, any of you who are keeping a close eye on what's going on in your community know that there are lots of breaches of this at times, which is oftentimes down to the fact that people just don't fully appreciate what 2 metres actually is. I mean, remember that if you happen to know somebody who's 6 foot 6 inches tall, it's not a lot of people who are that tall. That person is not quite 2 metres. They're almost, but not quite. So it's essentially the height of a door. If that door was tilted down, lying on the ground in front of you, that's how far away you need to be from other people to implement that 2 metre advice, and it's really important. Keeping physically active if possible is also extremely important, and you should ask someone to refill your prescription medications and get them over the counter as well, and other supplies if necessary, like tissues, thermometers, which I know are selling out like hotcakes everywhere. You should, very importantly, make a joint plan with your family, friends and neighbours on what to do if you or your carer, for example, becomes ill, so that you'll be able to continue to function. Absolutely stay at home if you're sick, as long as you are able to manage that illness, and I'll touch on that a little bit further in a moment. This is all about stopping the spread of the infection. So keeping well is very important. That's keeping yourself mobile, getting up and about, moving around as much as possible. Getting into the back garden is really important to get some fresh air, but remember to stay at least absolute minimum 1 metre away from other people. Really what we're looking for is 2 metres away from other people. Self-isolation is very frustrating, boring. I've already said it goes against every instinct that we have, and it can affect your mood and get you down. That's totally understandable. There's a lot of people going through exactly the same thing right now. You may find it helps to stay in touch with family and friends on the phone, social media. That's really important advice. It's also important to know that in pregnancy, your asthma care should absolutely continue exactly as it is currently. Do not stop asthma medications when you fall pregnant. The risks to your baby are far greater if your asthma gets out of control than any side effect from medications. And coronavirus doesn't change that one bit. So it's really important to stick with your asthma management care through pregnancy. Self-isolation, I want to quickly run through again. It's so important that you do self-isolate if you have coronavirus or if you have symptoms of coronavirus. Now, of course, asthma patients know all about the symptoms of coronavirus long before coronavirus became an issue. And it's very difficult for anybody to know for sure if they have coronavirus or not. But the message really is to assume you have coronavirus if you have a worsening of your respiratory symptoms. It's in particular the case that flu-like symptoms would be a giveaway that you may well be coming down with COVID-19. So if you have a fever, especially a fever, a temperature over 38 degrees, there's no doubt that meets the criteria, along with a worsened cough and worsened breathing. That's so typical of asthma. You could be having achy pains all over. You could be feeling hot and cold, shivery and shaky, just like with any sort of a flu-like illness. Your cough may have changed in character or gotten a little bit worse. And they currently would be highly suspect symptoms for coronavirus, asthma or no asthma. So if you find that your chest condition has worsened in recent days or weeks, there has to be a high suspicion for COVID virus being behind it. But the treatment and the advice is exactly the same as has been mentioned throughout the HSE postings on this and all the information you've gotten from the HSE, which is where possible you try and manage this at home and you self-isolate for the protection of other members of your family. If you're self-isolating, your other family members should be on restricted movements as well, and supporting you through your self-isolation. They're free to go out on their own, implementing this very careful social distancing from other people, but you yourself should try and absolutely stay put and self-isolate at home in the house. Other things to say about self-isolation, the coronavirus in asthma, the same as in people who don't have asthma, mainly causes mild symptoms. So there is nothing coming through in the international literature to suggest that an asthma patient has a hellish outlook compared to other people who don't have asthma. That's not really the message we're seeing. What we are seeing is that people who have lots of diseases are doing worse. They're getting more serious episodes of illness from the coronavirus. People who are a lot older tend to have a higher risk as well. But there are, as you know, if you're following the media, there are instances of quite young, relatively young people getting very ill with this disease also. So it's just so important to make no assumptions about how safe or unsafe the disease is. You should only stop your self-isolation when you've been a full 14 days from the onset of the symptoms. And you also have to make sure that you haven't had a fever for the last 5 days when you're coming out of self-isolation. So that's really important advice. You shouldn't be going to work in that situation. You shouldn't be sharing things like your kitchen utensils, your bathroom, your towel. You should be trying to, if you are in a single bathroom household and trying to self-isolate, it's so important that you meticulously clean everything after use, that you, for meals, that you are the last person to eat and you take your utensils with you to your room. So don't share any of those things. With that said, I'm going to go into a couple of other pieces of important information that will apply to everybody who's watching this from an asthma point of view. It's just to know that the Global Initiative for Asthma, the GINA group, have put out some important, helpful comments about asthma. So this, what I'm telling you now, is worldwide advice for patients with asthma coming from the world's leading experts. And that's that people with asthma should continue to take all of their inhaled medication, including their inhaled steroid that they're on. That would be brown inhalers or stronger inhalers that have steroid and another bronchodilator built into the inhaler. So they continue taking all of their usual inhaled medication that they've been prescribed by their doctor. It's important that if you have a flare-up of your asthma, an acute asthma exacerbation, as we often call it medically, that you take the treatment that's recommended. And in that situation, it's usually going to be a short course of oral steroids. It's often the drug deltacortril in this country, 40 milligrams for 5 days. That's absolutely the right thing to continue to do, coronavirus or no coronavirus, based on the best of our current knowledge. You should absolutely be following your written asthma action plan. So I have an example of that document again here. So you're all used to seeing this probably. It takes the traffic light approach of a green section and an amber section and a red section. And it describes what you should be doing day to day with your asthma when you have such a document from your GP or your nurse, your practice nurse. The asthma advice line can give advice as well to patients on the kind of things that should be in that action plan that you then discuss with your doctor. But following the action plan is essential all year round, and again, the coronavirus doesn't change that advice. The coronavirus, as a respiratory airborne virus, will behave just like other wintertime flu-like illnesses that tend to often set off asthma a bit more than somebody who doesn't have asthma, as in the cold that goes to your chest when you have asthma, as opposed to the cold that just stays as a head cold in people who don't have asthma. So that same process will still happen to asthma patients when they encounter this virus as with other viruses. But the important thing to say is that patients who are very closely following their asthma action plan, staying on their inhalers all year round, have a much lower chance of that cold going to their chest, regardless of what the virus is. So last year, the year before, if you were really good at sticking to your therapy all year round, you are much less likely to get your asthma worsening than an asthma patient who doesn't stay on their inhaler treatment all year round. So that's a really important message that hasn't changed. It's also important that there are rare instances of patients, I see more of these patients because of being an asthma specialist, who are on long-term oral steroids on top of their inhalers. And that treatment is to be continued. You don't change it abruptly or suddenly ever, and the coronavirus would not be a reason to abruptly change that treatment either. Nebulizer is another thing to just talk about. If you're feeling pretty well at home, you don't have symptoms of coronavirus, there's no reason not to continue using the occasional nebulizer for relief if you have one, although we prefer you actually use handheld inhalers for relief in all instances rather than a nebulizer. But you would find, if you got ill enough to come into hospital, that we'll be probably trying to minimize the use of a nebulizer if we can, and increase the use of a spacer device with a blue inhaler in order to give you relief in hospital. And the reasons for that are because, for those who've ever used a nebulizer, they know that this misty steam-like appearance comes out of the nebulizer, and that in theory can carry some viral particles, so it has a small little bit of increased risk for spreading virus to other healthcare workers, and for that reason it's the case that we are minimizing the use of a nebulizer unless absolutely necessary, and maximizing the use of a spacer with a blue inhaler for asthma that is upset or misbehaving, because if asthma is upset or misbehaving in the current climate, it's very likely that coronavirus could be there doing it. So we have to assume that until proven otherwise. And that's why it's best to minimize nebulizer for relief of worsening asthma right now, and instead use a spacer device with a blue inhaler for that relief. It's also been mentioned by the GINA guidelines that anybody who's on nasal steroids for their hay fever should continue taking them in the usual way. They shouldn't stop them out of fear of it having anything to do with upsetting the coronavirus outlook. And finally, you'll also have noticed that the hospitals have largely stopped doing any kind of outpatient work because we're all ramping up and gearing up for the coming surge, and you'll therefore for example, not be getting routine pulmonary function testing at this point in time. We're doing that deliberately in keeping with international advice not to be doing pulmonary function tests unless necessary at the moment. I'll quickly touch as well for our COPD audience who might be watching this Facebook Live, that the GOLD group, which is the COPD guideline group, have also put out some guidance on coronavirus. And of course, elderly patients are more likely to have COPD in the first place, and they are therefore a little more at risk than younger people for trouble from coronavirus. But what's important is that the international COPD experts are not aware of any evidence that should say you should stop any of the inhalers that you're using in COPD, and that specifically includes inhaled steroid. Again, it's really important if you're on inhaled steroid for your COPD that you continue to take that medication in the usual way. There is no change to therapy needed because of coronavirus. And if you need oxygen as a maintenance treatment, you continue using that, and oxygen would be used in hospital in the same way that we always use oxygen in hospital to protect patients from low levels of oxygen when necessary. If there's anything new that comes to light that changes this advice, the HSE will be putting that information out there. So that's just important to be aware that there is no greatly worsened outlook or prognosis specific to having asthma or COPD with this disease. It's more so to do with having a lot of illnesses, being frail, having poor health in general, and being more elderly. That puts people at increased risk for trouble from coronavirus. So some questions that have come in earlier, I'll try and touch on some of these in the time ahead. So earlier, Philomena Guinan, thanks Philomena for your question. You asked, how will I know if the cough and breathlessness that I get is due to COVID-19 rather than asthma? And will it be more severe? Will we be examined by our GP, or will we have our symptoms checked, or will we be tested? So there's a lot of questions in there. I mean, the cough and breathlessness of COVID-19 is a symptom that a lot of patients with asthma will know all too well. So what I've said earlier very much applies here, Philomena, which is that if your chest is deteriorating, you should follow what's ideally in your written asthma action plan if you have it. So that has a section that's amber and a section that's red. The amber section is that if you have been instructed to increase your inhaled steroid when your symptoms worsen, then you should do that in the way that was specifically individualized for you in your tailored treatment plan that you got from your GP or from your asthma nurse. And when you're in the red zone of that plan, which is where symptoms are frightening or dangerous or you're worried, that is exactly the same as always a reason to present to hospital, and that should not change in the coronavirus era. All of the hospitals are taking huge precautions to correctly implement social distancing and spacing in their facilities to minimize the chances of anybody contracting COVID-19 from coming into hospital. So it is the wrong thing to do to stay away from hospital when you were in need of hospital care. I cannot stress that enough. There's enough dangerous illnesses in the world without adding to bad health outcomes by staying away from a hospital where you need hospital care. So if asthma deteriorates into the red zone of an action plan, what would normally happen is you would need to see a doctor pretty soon, usually that day. Speak to a doctor. In the current climate, that could be a telephone consultation with your GP, who may instruct you to go ahead and take your oral steroids if that's part of your action plan that you already have. If you haven't been on steroids before and you don't have such a plan, if you're in the red zone of your action plan with worsening symptoms that are becoming frightening, you will absolutely need to go to your nearest emergency department to be treated and assessed. It's likely that if you have the typical symptoms of an asthma exacerbation and a fever, you will be tested for coronavirus. But the test doesn't change the treatment, because if you are, again, tuned into all of the information out there, you know that we do not yet have a specific treatment for coronavirus. It's supportive care. There are clinical trials that are underway, testing experimental therapies, but these are still experimental therapies. But the treatment for your asthma exacerbation will be exactly the same now as before the coronavirus. That means that inpatients will be given a lot of bronchodilators. The only difference they might notice is that we'll be tending more towards the spacer device rather than nebulizers to give relief. But you'll still be getting the steroid pills that are typically given in patients when their asthma is bad. Antibiotics will be given if it looks like there's pneumonia, even though, of course, the pneumonia could be due to coronavirus. But we just give antibiotics for the preventable bacterial type of pneumonia when we don't know for certain what is actually causing that chest x-ray appearance. So hospital is the correct place to be when you are frightened by your symptoms. Anna Reynolds-Teague, thanks Anna for your question. You asked how people with asthma and COPD are faring once they get the virus. I'm looking after coronavirus patients currently, as are all of my colleagues in the respiratory consultant community. Our colleagues in infectious disease are heroes at this. They're helping to set up protocols very rapidly at very short notice in all the hospitals around Ireland. Emergency department doctors and nurses, intensive care doctors and nurses, all the other healthcare staff who are doing amazing work, the cleaners, everybody who's putting themselves out there using the protective personal equipment that you're hearing all about. So everybody's involved in this battle, but what I can say is that I have no sense that asthma or COPD patients are doing any worse than anybody else. I mean, as long as asthma is looked after correctly and COPD is looked after correctly, the coronavirus is just an added extra on top that we just have to deal with. There are people with asthma and COPD coming into hospital with coronavirus, because there's always people with asthma and COPD coming into hospital. But the coronavirus is added in on top. PK, who just sent in initials, has asked, what can people with asthma expect if they contract the virus? So, touching on what I've said earlier, the virus is suspected to be a trigger for asthma without there being clear, definite proof in the literature of this. But it's our assumption that, like with other respiratory viruses, like the flu, and like what happened with the SARS epidemic a few years ago, what happened with the MERS virus, which was an even more dangerous virus, it's a trigger. Viruses are a trigger for asthma. And so people can expect that if they're not taking their preventers all year round, that they're more susceptible to getting chesty when they pick up a virus. And coronavirus is a particularly bad flu-like set of symptoms, so it will go to the chest much more likely in a patient who has asthma than a patient who doesn't. Barbara Nehanrook, thank you Barbara for your question earlier. You said here, my asthma is only really brought on by pollen. Should I be taking my preventer anyway now? I usually only take it in the summer. So that's an interesting question, Barbara. Again, as an asthma specialist and following international and national guidance for asthma, part of our role is to help educate more healthcare providers and patients about asthma, because where you may have in the past had a recommendation to have just treatment at a certain time of the year, that's out of date as a recommendation for asthma patients. And anyone with anything other than the most trivial, almost non-existent asthma should really be all year round on preventative asthma inhaler therapy. We know that we recommend this because there are some patients who have, by definition, mild asthma who can still end up in a hospital, in an emergency department. There are still in 2020, unfortunately, deaths that happen from asthma. Just like in any other year, there's been a small number of asthma deaths, and we know that while most of those deaths happen to people with severe asthma, a small minority of those deaths happen to people who had seemingly mild asthma before they had their fatal episode. And that's very frightening, but that is part of why there is a uniform across the board, worldwide, non-controversial recommendation that everybody with mild asthma should be on maintenance treatment with an inhaled steroid type treatment, and the coronavirus doesn't change that advice. So my recommendation to you, Barbara, would be that you probably should get on your brown inhaler if that's what you have. Even though I appreciate for you, typically viruses haven't been triggers, but you haven't met the coronavirus before as a potential trigger, much like any other patient hasn't met this virus before. It's a new virus. We don't know enough about it. So the safe thing to do when you have asthma is to implement good asthma care. So to use your preventer is certainly what I would recommend. You also mentioned that your 6-year-old son takes inhalers when your 6-year-old child takes inhalers, your daughter, when she has a cold or chest infection, and should that child be getting a preventer inhaler now? So I'm not a pediatric doctor, but the guidelines internationally for 6-year-olds with asthma would be very much consistent with what I just said. If your child definitely has asthma, that's the caveat. Is the diagnosis of asthma correct? But if the diagnosis is correct, such patients who get trouble during the year from their asthma should be on all year round preventer treatment while they still have asthma. So that's something to talk to your doctor about. There's an anonymous question we got earlier. I have asthma. Should I increase the amount of times I'm using my controller / reliever inhaler medication during this worrying time? So what I would say to you is that there is no one-size-fits-all advice for extra treatment to take when your asthma worsens. That's why it's so important for you to talk to your asthma doctor about getting a written asthma action plan, the one that I just showed you that has the green and the amber and the red sections, because it will be very medication specific as to what action you take with your controllers when you need more controller medication. But in principle, it's the case that when your asthma symptoms worsen and you're getting symptoms more than twice a week, that you should be upping your controller medication in the manner in which it was explained to you to do that correctly. There are some controllers where you shouldn't take extra puffs of that controller, so I can't say to do this without knowing specifically what medication you're taking, and it's something that should be organised by your GP, not through an interaction like we're doing here. It needs your doctor to go into your asthma plan in detail. But the principle is correct. Yes, it needs more treatment when things worsen. Another question here. So Sue Smith sent in a question, and thank you, Sue. My 10-year-old son's asthma is very bad. The last week he has been taking his preventative inhaler religiously twice a day, and he's on 5 Ventolin, and he is still very short of breath and phlegmy. His inhaler was only changed 6 months ago to a stronger one. Is there anything else that we can do to help him? So my advice here again is to very much call your doctor, and I appreciate that it can be hard to get through to doctors right now, but the reason you need to get physician advice at this point is that that child, if the asthma is deteriorating, may need steroid treatment to be considered. And if there's a written asthma action plan that makes that clear, then that's the thing to do. And if the child is too unwell to be at home, as I've said already, it's really important to go to your local emergency department. Asthma is dangerous in some people, coronavirus or no coronavirus, so it's really important that you go and get the care your asthma needs if it's needed, in the red zone in particular. Another anonymous question here, which was, hi, I'm asthmatic and I've been working from home the last 3 weeks. Again, well done there. That's the thing that everybody should be trying to do, other than me, when I'm in and out of hospital all the time for the next few months. So my asthma has begun to get very bad, so I've been on steroids and have just had a COVID test yesterday. I have Becotide and Ventolin and Singulair. I have very restricted breathing, but I'm not sick other than this. I've been in touch with my doctor. Is there anything else I can do? And I'm at home isolating with my family. So that person is describing a challenging situation for sure. I'd be concerned at the comment of, I have very restricted breathing. Breathlessness is dangerous, and if that breathlessness is worsening and you're frightened and finding it difficult to breathe, it's a reason to need a step up in treatment. If you're already on steroids, as you've said, the natural and correct thing to do in that situation is to go to hospital. You will probably need to be admitted if you are worsening despite being about 2 days on steroids, because at that stage they should start to kick in. And I would never sit at home waiting for a treatment to work if it's getting into frightening symptom territory. It's always correct to immediately go to hospital if you're getting no relief from following the 5-step rule. Again, that's taking 10 puffs of a blue inhaler like Ventolin in over 10 minutes, waiting to see if you get some relief. And if relief isn't coming, you call for urgent help to get to hospital and take another 10 puffs after a 10-minute gap. So after 20 minutes, you've done this twice. And when you get to hospital, you'll be getting more and more of that treatment while you wait for steroids of a different dose or extra medications to kick in. So it's always correct to go to hospital when you're deteriorating to that extent. So that's a flavour of the kind of questions that are coming through, and I see a lot more questions are coming through on screen. We will be looking at those questions, and thank you very much for sending them in. We have frequently asked questions already up on our site, that I would recommend you go to and check the FAQ section of the Asthma Society of Ireland. But we will, in light of the Facebook Live and all the new questions coming through, we will try and tweak that and amend that in case there's other things that need to be addressed. And thank you very much for putting up with what is changed times for everybody at the moment. But by implementing the advice that you're hearing every night from Tony Holohan's office, that is the way for us to finally get a handle on this and minimise the damage to all of us and our loved ones. Okay, I'm going to leave it at that for now. Thank you very much.